Hi, I'm Dr. Chong Choon Seng. I'm a colorectal surgeon practicing in Mount Elizabeth Hospital. So when I started doing surgery, I really enjoyed the hands-on, where I could literally cure a disease with what I do with my hands. And then slowly, when I started to notice that I enjoy treating patients with cancer, I explored the colorectal surgery because there is, number one, most number of patients with cancer are in that field. And secondly, the gut is always a bit of a challenge. There are so many possibilities, different types of outcomes, and I find it extremely rewarding to treat patients with colorectal cancer. I would say that firstly, evidence-based practice medicine. I think we all know that everything we do should have some form of evidence, or at least some kind of experience that allow us to know what is the best form of treatment it is. The second one is really an experienced clinician. I mean, being a clinician for 20 years, I would say that a lot of times my experience also tells me what is suitable. I think the last one, I would say that it is also about empowerment. By empowering the patient to understand her condition or his condition, and a lot of times it's the clinician combined with the patient's effort that lead to a better outcome. Actually, colorectal cancer is pretty common, and we also know that it is actually preventable. A lot of times screening just picks up early cancer diagnosis. But to prevent cancer, you need to have a stage where before the cancer exists, you can actually treat it and remove it. Because the stage that it exists is the colon polyp. And so most of the time, if we can do like an endoscopy or a colonoscopy and we can remove the polyp before it becomes a cancer, there's also other things that I'll advise most of my patients to do, which is to have a healthy lifestyle. Having not just a balanced diet, regular exercise, don't smoke, don't drink, and also having that regular screening activities done. Because these are really proven to be effective. They save life, cut costs, and get a better quality of life. Always? And in fact, in studies, it is well proven that symptoms-based diagnosis is actually rather inaccurate. Because early cancers do not have symptoms. And the symptoms like blood in stools, constipation, as well as abdominal pain, and even things like change in bowel habit. These kind of symptoms tend to overlap with like hemorrhoids, or even patients who have like infection in the gut, or sometimes they may have like some kind of benign growth. And all these conditions doesn't help us understand what is the actual cause unless we do further investigations. Always seek a professional consultation, because that's the only way to understand whether you really need to have another investigation and whether you are at risk of having a colorectal cancer.